David sent in what's a useful question here, because I think, because we've talked about, you know, your clinical testing regime over there. He's asked about what do you look for in terms of signs and symptoms apart from the obvious, and I think he's talking sort of immediately post-injury, because as I said, in the old days it was when you answer a simple question, who's the Prime Minister or whatever it might be. That's pretty difficult in this country, perhaps at this time, because it might be vary from day to day. But you know, you ask them a simple question. But now we've got better protocols. But what sort of things are being commonly missed by people checking for concussion, particularly in amateur sport?
I think in amateur sport it has to be said that all you need is a mechanism of injury and one of the 22 signs of concussion, and at amateur sport level they should be off regardless.
Right. And those 22 signs are readily available, I'm sure, somewhere.
Yeah, absolutely. Yeah. But you know, the key thing is that the Scottish Rugby Union have got a lovely slogan: if in doubt, sit them out. There should be absolutely no questions asked, no Prime Minister questions and what's your name questions in amateur sport. Any mechanism or any one of the 22 signs, they're off. Wow. And if in doubt, sit them out. It's just not worth it. Yeah. I think in terms of professional sport, then you could then go on to ask a few questions. Obviously, on a pitch side situation, your primary thing to look for is, particularly if they've lost consciousness or they're lying flat and unresponsive, is, you know, are they breathing? Have they got a cervical spine injury? Those are the first two things that you should always be looking at. I think one of the questions that we always asked first was, certainly when I was a physio back in the olden days when I could run on the pitch, it was just to simply ask what their name is, you know, and at least you know that they're responding to you.
Depends on you knowing what their name is as well.
Yeah, exactly. Oh, yeah, I don't know if that's right or not. And then you may go on to ask a series of what we call Maddox questions. Right. And you know, as I say, once you've ruled out that there's any cervical spine injury, you might then get them up into sitting, but you're then looking for one of those 22 signs of concussion as well. So you might sit them up, they might answer all the questions perfectly, they get on their feet, and the first thing they do is run in the opposite direction to where they're playing. And then you think, actually, they haven't got a clue which way they're going. Yes. And you see this a lot on some of the fantastic videos that the NFL put out, where, you know, they'll, you know, see these huge collisions, and the first thing that happens is this player gets off and then sort of stumbles and collapses, and his mates are holding him up and they can't try and carry him on. So that's what you should be looking for.
Okay.